So the next presenter is.
Good afternoon all. I have a case report of sodium sapple keratitis, and Calotropis procera is a flowering shrub belonging to the family Apocynaceae and abundantly grown in Indian subcontinent, and it also known as sodium sapple, solan oat, and milkweed and madar. And exposure to Calotropis latus is common occurrence where religious festivities preferred to the use of garlands. So it in the stages of it can be a stage acute acid injury, which can be with pain and respond to the acidity of the sap. So the symptoms will be burning, irritation, lacrimation, photophobia. It can present with a stage of without pain also due to the toxic effect of the latex on ocular tissue, inherent analgesic property of the sap. So symptoms will be only the decreased vision. So this stage. Then next stage, it can be cause only the descending membrane fold due to toxic effect. That latex can penetrate the intact cornea and produce permanent endothelial damage. So here the symptoms also be diminution of vision. So here a 67-year-old male, he came to OPD with the diminution of vision and colored halo since 1 day, and there is no pain. And recently he has undergone a cataract surgery two months back. And his best character visual acuity in both eyes was 20/120, and IOP in both eyes was 16 mmHg. So here anterior segment examination right eye shows there is a mild congestion, mild circumcorneal congestion with diffuse Desmond fold, and that temporally and nasally the few stains are taken in the conjunctival part with punctate mild erosion in the cornea, and OCT shows the DM fold with mild corneal edema. The anterior segment of the left eye shows the same as the right eye with a diffused DM fold with corneal edema with punctate staining positive in the cornea, and here also the OCT picture shows the Desmond fold with mild corneal edema. So we are treated with penicillin assisted 1%, 4 times a day. We have tapered 3 days per week, and he was reported to the hospital after 2 days, and his visual acuity was improved to 6/6 with no descending membrane fold. And we are not able to take pachymetry and corneal endothelium count. So Calotropis procera latex can present with a varied symptoms and ocular examination findings. So management depends on the time of presentation, and irrigation with 500 ml ringer lactate with no benefit after 24 hours. So if acute presentation, if with pain, we can give a wash, and with the litmus paper we can see the severity of the acid. If it till the litmus paper is not turned to red, we have to give the wash, and to confirm the remove the toxins, and it will decrease the absorption too. And the sap of the Calotropis procera has been found to contain histamine and prostaglandin, which may lead to the iridocyclitis. So the latex of Calotropis procera contain several alkaloids which are causatic and considered poisonous in nature. So profound fall in the number of corneal endothelial cells. The ocular lesions are easily preventable by increasing the awareness and wearing protective glass. These are my references. Thank you.
Have you ever tried to compare your medication, like you have used the prednisolone acetate, and with low dose steroids, low potent steroids?
Actually, this was like a study of case series. Before collecting the cases, I have posted 1 year back. So now we have a lot of cases is there. So we didn't tried low dose steroid. Just if we will be
Because
adding antibiotic.
I have seen patients who get cured with low potent steroids also. So rather than exposing them to a higher potent steroid, which can cause raise in IOP if he is a steroid responder.
Usually it will be present with inflammation and maybe some discharge first day. So that time we will be starting only with antibiotics. The most of the times in 1 day it is getting cured for some patients. So if anti-segment inflammation or AC inflammation is there, we are going with the steroids. If Desmond folds is there, we are going with penicillin acetate only.
But it is not.
Short treatment.
Yes, it
Short treatment
usually
with the steroids,
cures
right?
Yes, ma'am.
Yeah,
One
so I do not see any.
There is no discharge, was there, no inflammation, so we stick only with the steroids. Because this patient is 2 months history of recent cataract surgery, so we stick on the
Within
steroid.
24 hours, if the presentation is there and you can decrease the toxin by rigolactate, then you put that patient on further treatment. Have you seen any changes after that?
Usually patient will be coming within
Not
24
within
hours.
24 hours.